woman who had surgery found out years later a foreign object had been left inside of her. She suffered years of undiagnosed pain.
But as CBS 2 investigator Dave Savini found out, this type of surgical mistake is getting shockingly more common. He's here with this original report. Dave.
Kate and Rob, she says having the object left inside her was just the beginning of her troubles. She invited us to be at her bedside when the foreign object was finally removed.
I love you. I love you.
A mistake that started for Sarah Cunningham inside one hospital ended here in another hospital attempting to repair her.
Mommy's got to heal right now, okay?
This foreign object was left inside her body after a surgery years ago. You really want to know what this thing is?
Yes.
And who left it in there?
Yeah.
In 2010, Cunningham had back surgery at Rush Copley in Aurora. In 2011, Cunningham's daughter was born. A C-section was performed at Central DuPage in Winfield. Then for years, she says, she suffered from intense, chronic abdominal pain.
A sharp stabbing pain would wake me up.
That pain sent her repeatedly to Central DuPage's emergency room to figure out what was wrong.
What were some of the things they told you every time you showed up for treatment?
If I showed up for treatment, it was, you're a drug seeker, there's nothing wrong with you.
She even had 2 CT scans at Central DuPage. Then in 2015, she switched to a different hospital, Adventist Glen Oaks in Glendale Heights. Another scan was done there, and that's when Cunningham learned about the foreign object inside her.
I was shocked.
More shock when she went back to Central DuPage and got her old records. Her 2 CT scans taken just months apart in 2013 both indicated a foreign object inside her.
This scan showed somebody knew about it years ago.
And didn't even tell me.
She was being told rather directly that it was all in her head, that she's crazy.
Attorney Laird Osmond represents Cunningham.
There was an obligation to get it out of there.
Foreign objects left in surgical patients are only voluntarily reported by hospitals to a federal agency. Those records show Illinois had a 49% increase in this problem, with 67 cases in 2009, rising to 100 cases in 2013.
It can lead to infection, it can lead to death.
Dr. Ronald Wyatt is with the Joint Commission, which accredits hospitals. He heads up a unit that investigates foreign object cases.
There's probably 2,000 to 4,000 of these events that occur in the U.S. per year. It's vastly underreported, and that's a significant issue as well.
He says sponges are most often what's left behind. In Cunningham's case, it's still unclear exactly what this is or who left it inside her.
But the anger and the hurt is still there constantly, day after day.
Rush Copley had no comment because of patient privacy. Central DuPage says they are thoroughly reviewing the situation, but given the location of the object, they do not believe it was left behind during her surgery there. Cunningham's lawyer says she likely can't sue whoever left the object in her because she didn't find out about it in time, and there are legal statutes that protect hospitals. He says she can, however, file for her alleged lack of follow-up care.
So she can sue. It's just the question is who.
She can, but she can't go back further to the original surgeries.
And the statute of limitations has expired because she was not made aware, perhaps, even when others might have known.
So a 2 to 4 year range, and it's past that.
Wow, incredible.
All right.
Thanks,
Dave.
Dave.
Appreciate it.